Looking a little bit at cavities, again, we have a cavity risk assessment, and we have a personalized cavity assessment for when they leave after the evaluation. And cavities come to us in all shapes and sizes, different levels of severity, but there's significant oral imbalance and microbes when they have this disease. So one of the things that we want to do is talk to our patients not only about the local factors that it can have to significant dental destruction, loss of posterior teeth, and severe problems from caries, but also this systemic idea. And this was one paper that talked about how if patients have a positive rate of strep mutans, that if they have strep mutans, that in these cardiovascular specimens, 78% of them had strep mutans in the cardiovascular blockage. So these are significant bacteria that also cruise around through the system, and it's something that we need to be aware of. They're just also not healthy. How we educate our patients is with graphic pieces, and so this is a little tip on dental education, but we post different graphic pieces that we've created. These are the kind of pieces that we customize for people, but these are different things that we do to help educate our patient. We post stuff in the practice. We have obviously our risk assessment and our personalized assessment tools. We give out books, free books. The caryfree.com company has nice books called Balance, helps patients understand if they have an oral imbalance. And then we're always discussing the transferability factor. Patients are fascinated to learn that this disease is transferable. And again, these tools are available through our network. Also, some cavity-causing bacteria stop the production of nitric oxide. Nitric oxide, there's not a large amount of this made in the mouth, but some is. And this nitric oxide is made from foods we eat, from healthy bacteria. And when we have strep mutans and cavity-causing bacteria, we can eliminate or we can diminish the ability of these bacteria to do this. So we like to share with our patients that have caries how to increase their nitric food-producing products, and then obviously how to obviously eat healthier in a number of ways. But Dr. Kahn, who's a local physician to the Detroit area, has a book, The Whole Heart Solution, and he's a vegan and a vegetarian. And so we encourage our patients to, and many disease entities, to move more to a plant-based, low animal intake diet. And he actually has a recipe in his book on how to put load nitrates on a plate with all vegetables. It's a nice thing. Patients enjoy that. A couple things about management strategies for cavities. We know it's a disease of susceptibility, so patients feel a lot less guilty when they learn that, and that there's a transferability issue, and that you need the right environment for cavities, so it's usually an oral imbalance, and that there's rinse systems and chew systems now that we can use to change the alkalinity of somebody's mouth, and we can remineralize the teeth, and we can modify the diet, and I think everybody's aware of that. Easy thing to do. And then there's maintenance products to help manage the disease as well.